Hey everybody, how you doing? Steve Martirano here. A moment before we get into the nitty gritty here. Now, I got to remind you again. You will have our eternal gratitude if you just click that subscription button. We need we need your support in that fashion. Hit the button, subscribe. We'll love you long time here on the Behavioral Corner. Hi and welcome. I'm Steve Martirano, and this is the Behavioral Corner. You're invited to hang with us as we discuss the ways we live today, the choices we make, the things we do, and how they affect our health and well-being. So you're on the corner, the Behavioral Corner. Please hang around a while. Hi everybody, welcome to the Behavioral Corner. It's me again, Steve Martirano. I hang here in the hopes, and I'm never disappointed, in that we will run into some interesting people. The Behavioral Corner is underwritten by our partners, Retreat Behavioral Health. You'll hear about them a little bit down the road. What we're about is the business of talking about behavioral health, and that's a gigantic field. And that's why we like to refer to the podcast as a podcast about everything. I got a good one for you today. This is something that interested me for a very long time when I became aware of it. We're going to be talking to the CEO of a company called BrainsWay. They are a global technology company. What they do is develop cutting-edge medical devices, a wide range of those. We're going to talk about one that's very exciting specifically, and that is the transcranial magnetic stimulation. TMS is what we're going to talk about. There's some very exciting things going on with this device and its treatment for certain mental health disorders. To tell us all about that, we go to the top. You know how we work here on the corner. We have their CEO, Chris Von Jako. Von Jako, did I get it right, Chris?
Jako? Von Jako, close enough.
Jako.
That's fine.
Jako.
Yeah.
I'm sorry.
Yeah.
And I rehearsed that earlier. Chris has been in this sector, this field, for over 30 years, and he's the holder of multiple degrees. He Ph.D. in biomedical sciences. He's got an MS in radiological sciences, as well as an MS in physics and mathematics. I'm humbled by this man's time spent in school. Chris, thanks for joining us here on the Behavioral Corner.
Well, thank you for having me. It's a real pleasure to be here to talk to you about this technology. So fire away.
Well, let's do it then. Let's begin with what it isn't, and then we'll get into what it is. I think in the popular imagination, when you talk about stimulating somebody's cranium in a mental health context, what comes to mind is the Academy Award-winning motion picture One Flew Over the Cuckoo's Nest, based on the famous book. And in that, of course, the McMurtry character, Jack Nicholson, is subjected to electric shock therapy. In a punitive sense, it was used to punish him and subdue him. So it's a very horrific thing. And I think in the popular imagination, people go away thinking, well, that's what when they plug these things in, that's what it's like. TMS is not that, is it?
Correct. It's not that. It's actually completely different.
Let's
and I'll get into it when you want me to get into it.
Well, I do want you. Let's get into it. So, if it's not that, what is it?
So, in fairness, let's just start with electric shock therapy, or now known as ECT today. That's been around for over 100 years. That was a very dramatic scene, which shown there, where you're shocking the patient's brain with electricity, and you're trying to create a seizure within the brain. It's very much like taking your computer and rebooting it. So that's what you're trying to do with the brain. So electric shock therapy is used in the United States and around the world. It's probably actually one of the most effective things for depression today, but people are very afraid of it because of that scene, and also because of the side effects that they have with it, which is could be short-term and long-term memory loss, and people in general are afraid of it. But in reality today, electric shock therapy is also done under anesthesia and can be quite effective. But what we're talking about today is transcranial magnetic stimulation. This technology was actually originally invented back in 1985 in England. And the original kind of thought around it was like, can we evoke can we put an electrical signal into the brain non-invasively And that's what they did back then. And the way they did it was they used a coil, and in that coil they put in an alternating current. And when they put an alternating current into the coil, what it created was a magnetic field, and you can stimulate a magnetic field into the brain. And how they knew it was working is the brain on both sides. Some people may know this, but you have what's called the motor cortex. So it's the surface of the brain, and you have the motor area in the surface of the brain. It's kind of on the side of each of your head. Mm-hmm. And as some people know, and they learn this, growing up, the left side of your brain controls the right side, and the right side controls the left side. So what they did was they invoked this magnetic field into the brain from the outside, non-invasively, and it moved somebody's hand. And they're like, wow. So diagnostically, they thought to themselves, could do something, non-invasively. They could, move the motor cortex and do other things.
Was that the impetus for trying this technology out to be
absolutely
less invasive?
Yep, that's exactly what it was. And so then some smart people, and around the mid 90s, it took another 10 years, they started saying, could we actually do something? And this whole field kind of blew up, I would say, since 1985. People have been trying to do many different things with this non-invasive magnetic stimulation, right? So that's what they call it, transcranial. So it goes across the skull, magnetic, and then using magnets to stimulate the brain. And sort of in the mid 90s, they started looking at, there was Dr. Mark George down in South Carolina, started looking at, demonstrating the effects of this technology and using it repetitively over time to help people with depression. So that's how the whole thing started. And then it kept evolving. Well, so TMS, like I said, transcranial magnetic stimulation, has been, invented, 1985. And then started being used for these different things. Well, from our perspective, we had a researcher that happened to be originally from Israel, and he was over in the United States. He's a neuroscientist, and he was in the United States doing a postdoctorate at the NIH, National Institute of Health.
Right.
And he was specifically focused on looking at magnetic stimulation for addictions. And what he found out was, he said, your addiction area is a little bit deeper than potentially where your depression area is. So he developed a technology, which is the BrainsWay technology today, which we call not TMS, but we call deep TMS. So it goes deeper and broader into the brain. And this was a gentleman named, he's a professor now. He went back to Israel. He actually licensed the technology from the NIH. And then they started studying it for addictions and all different sorts of things. And then, lo and behold, they started a company, they raised some money. And then back in about 2013, the company got its first clearance, FDA clearance for depression treatments. The original technology, this just what we call traditional TMS, got the clearance back in 2008 for depression. But the beauty around deep TMS is that it goes deeper and broader. So it's not just focused on depression. It's a platform technology. And I'm sure you want to know what it's used for today, right?
Well, I do. But first, I want to focus in on this, the sort of origin story here. Why was it thought that this stimulation in the very beginning would be suited for? It sounds like it's suited specifically for depression rather than some other mental health disorder. Why was that?
Well, there were some obviously in the late 80s, the first antidepressant became FDA approved, and they were looking at chemically if they could do something. There was also, from a neuroscientist view, there was a lot of medical imaging that was done to try to figure out what parts of the brain don't work. When you have depression, is something happening? And sort of the thought was around that basically neurons which electrically fire in the brain, a certain location actually stop firing. Right. Yeah. And they were like, can we get that to happen now if we use this transcranial magnetic stimulation, which is essentially what you're doing when you're doing electric shock. You're trying to re-jumpstart the brain.
Yeah, the more we learn about the working of the brain, obviously, the better we can become in I'm not manipulating it, but being very precise about how to treat problems, because you got to treat them where they occur, not where you think they occur. So it's fascinating for me. Okay, so now we talked a little bit about depression. Deep TMS, which is what you guys are doing, goes beyond that. Or tell me, does it bypass depression and go right to the addiction centers and treat that? How does it work? What are you treating?
Great question. So we have 3 different coils today, or helmets in our case. And inside the helmets, we have 3 different coils. And these 3 different coils are focused on different parts of the brain. So we have a helmet that has a coil in it, which is our first FDA clearance, which treats depression. We just, about 9 months ago, also had an additional expansion for that. It's not only treating depression, but it's also helping treat patients with anxiety that also have depression. Those are very coincident with a lot of patients. About 60 to 90% of patients that have depression also have moderate to severe anxiety. So that's one area, and that treats sort of the front left part of the brain. Then we got clearance back in 2018. So the first clearance was depression in 2013. We got this anxious depression just clearance about 9 months ago. But then in 2018, we had another coil that's inside a different helmet that treats for OCD, so obsessive-compulsive disorder, which is a very, very unique brain disorder. Mm-hmm. And we could talk about that as well. And then late in 2020, we got clearance for our first addiction indication from the FDA, and that was for smoking addiction. Which is great because remember, the original sort of founder, inventor of the technology, Professor Zangin, he really was a neuroscientist looking at addictions. And his key thing is he's been looking at like smoking addiction and alcohol and a whole bunch of other addictions as well. So the thing that I love about Deep TMS is the fact that it's just not a one-trick pony. That allows you, it's a platform, so we can do a number of different things.
Yeah, that is interesting. So let's talk a little bit about side effects. What are the side effects of this technology?
Well, let's key into it from a perspective of let's talk about depression specifically, mm-hmm. right? Mm-hmm. So in depression, there's many medications, right? And unfortunately, CDC numbers, from 2019 prior to the pandemic was about 21 million people get depression each year. Okay. And about more than half of them, right? So over say close to 11 million of them don't have any benefit from that first medication that they take. Right. And a lot of people associate medications also with side effects, and there are a number of different side effects with antidepressants, right? You're talking about, whether it's weight gain, sexual side effects, GI issues. There's just a tremendous amount of different side effects and that's why there's a lot of these medications. There's probably, over 30 medications out there, different antidepressants. And so the side effects can be very, troublesome. And that's why people need to change out the medications. So when you look at Deep TMS and TMS in particular, there's really no side effects, main side effects with the technology. And it's been well studied, for many years now. Many patients have been done, many publications on it, and really essentially no side effects. So the safety profile is really good.
That's amazing. So your FDA approval, which you received each time you advance this technology, you undergo the same kind of trials that any, like a pharmaceutical drug or any other device would have to go through. The process seems very fast. I mean, it seems like you've been able to demonstrate we can do this, and oh, by the way, we think we can do that, and then you get approval for that. So you've got all those FDA approvals. You're under pretty rigorous scrutiny here, right?
Well, yeah. So it's a little bit different than the drugs. I will say that when the FDA goes from a drug standpoint, when they're looking at drugs, it is a little bit more rigorous because people are ingesting a drug and they want to make sure that they're studying it really completely. And they actually call those approvals. And you can do a lot more patients when you're looking at drugs. In our case, it's an FDA clearance. What the FDA is looking for is safety and efficacy,
Mhm.
right? So we go through an FDA clearance. Traditionally, there is potentially a prior company that's already cleared something. In our case, the traditional TMS was cleared. So we ended up doing a process of showing that we were efficacious as well as they were, and we also are safe as they were. So we got that clearance. When we did OCD, nobody had an OCD clearance before. So we had to do what was called the de novo, the first time ever. So it was a little bit more, in depth than say, just doing an FDA clearance. But in general, I could say the technology is extremely safe, and it is efficacious. And I have to say that if we're taking any of the things that we're treating, we are actually always treating the most difficult patients because we're treating those patients that failed
All right.
medications.
Yes.
So
They
it makes it even more difficult.
Yeah. This is an interesting topic. We're talking with the CEO of BrainsWay about a technology that they are at the leading edge of, and that is TMS, deep TMS, transcranial magnetic stimulation. So, Chris, let's get to the nitty gritty here now. If I am looking for this treatment, how do I prepare myself for it? Are there anything special I have to do to get ready to go get stimulated?
So, absolutely not. The question that I'm always asked about it is like awareness. So, thank you very much for helping us get the awareness out there. The other side is access. How do I get access to the technology? So, from a depression standpoint, the technology is paid by all insurance companies, most of them, I would say, throughout the United States, and that includes Medicare. Right, a lot of people associate Medicare with a safety net for I won't say the elderly, but I'll say for 65 and older. But what people don't know is that if you're if you have a disability, you also covered under Medicare as well. And so depression, OCD follows under that. So from a depression standpoint, over 250 million covered lives from an insurance standpoint, which is great. The difference, though, is that some insurance companies have more rigorous requirements in order for you to, be covered. So some insurance companies, in the beginning, it also took you had to fill 4 medications, right? And that can be a little bit of a nightmare because it can take 3 to 6 months for one medication to come up it, fail it, come down off of it. Then you go up and try another one, and then you come down that one. But since the pandemic and just prior to the pandemic, there has been a relaxation of some of those requirements by insurance companies. So a bunch of them have moved it from 4 down to 2, which is great. And in some cases, Medicare, you only have 1 failure, which is really nice. And then if you're thinking about OCD, obsessive-compulsive disorder, a year ago, if we were talking, we had 0 coverage. We were the first ones to get this clearance for OCD. There's only 5 medications out there for OCD. And again, it's about 50% of the time you won't get any, benefit from taking medications. So in our case, it's great. We're now started having coverage. About a year it started ago, but now we have about 60 million covered lives to date. So we're making more and more improvements with OCD, which is great.
There's a couple of things about keeping your eye on what insurance companies will cover. One is certainly if you're a consumer, you got to worry about what's out of pocket. But the second thing I always think of is the insurance companies are covering something. They are not doing it from some humanitarian position. They have figured out that this is a cost-effective procedure that will ultimately make them lowers their what they might have to pay out. This is an effective treatment. Let's cover it. Down the road, we'll all be better off for it. It's always a key thing when the insurance companies want to get involved. Tell me, Chris, about who administers the treatment once you're in the office. Does BrainsWay train people on how to do this?
Yeah, so it's a really great question. So we sell our technology to psychiatrists, and they have it in their offices. The psychiatrists typically do the first treatment, but they're there throughout the whole treatment. But it's typically a technician that can administer the treatment, which is really nice. We train up the psychiatrists on how to do the technology. And we also train up the technicians, and we're there to support them. We want them to be successful because obviously the more and more people they can treat, like I talked about, 21 million people in the United States get depression. It's probably more than that on the pandemic. And about 7 to 8 million have no effective treatment from medication alone. So these are the patients that we end up treating. And you just mentioned it, by the way. You mentioned like the insurance covering. The economic burden is over $300 billion per year for depression. Mm-hmm. So think about that. So whatever we can do. And by the way, a lot of people think about just the patient, but it also affects everybody around them as well. So, I think we have a phenomenal group that does a great job of doing training to make sure that everybody understands how the technology works and that it's administered correctly.
Let's talk about a little bit. I don't want to get too far in the weeds because we are not technicians here. How much energy is shot into your head or stimulated? What kind of juice are you giving people?
Well, I don't know if you've ever been in an MRI.
Yes, I have.
It's similar to going into an MRI. You hear this sort of knocking noises, right?
But you're not in an enclosed. Are you in an enclosed?
You're not
space?
in an enclosed space. You actually wear a helmet. In our technology, you wear a helmet, which is nice. With traditional TMS, they just put a magnet close to your head, but you're lying back in a dental chair and you can't move. With our device, we have a helmet on the patient's head so they can move their head around. They can watch TV. They can, sometimes they play Jenga with the technician or something like that during the treatment.
How can you know? That's interesting. You should bring that up. How can you know that the treatment is not being interfered with or altered if somebody is watching, the news and getting upset about it or depressed? I mean, I don't know. How does that work?
So traditionally, from a depression standpoint, again, what we're doing is stimulating a certain part of the brain, and we're trying to jumpstart that part of the brain. Think about it like, you're trying to work out a muscle, right? And I always think about it, in our case, our depression treatments can be anywhere as short as 3 minutes and as long as 19 minutes. It really depends on the protocol that's used by the psychiatrist and what's happening to that particular patient.
So it begins with the psychiatrist doing a traditional psychiatric evaluation of the patient.
Correct.
The patient is exhibiting these symptoms. Correct. You then understand what centers of the brain are involved in that process and accordingly map where the pulses are going to go. That's the way it works? Okay.
100%. Yep.
Yeah. So what with regard to the helmet, which is interesting. So you're not placing anything on anyone's head in any particular place. You put a helmet on. There's lots of electrodes up there, and then you just alter where the energy is coming from in those individual places. You don't move them around.
So what we do, that's a really great question. What we do is the patients actually put a cap on.
Right.
Cap actually is helpful for cleanliness, right? Because you don't want, many people are different, or, people are getting treatment. So you want from a cleanliness. So they have their own cap. And then the cap has a special grid on it. And that grid kind of gives you the coordinates. Think about like a GPS or something like that. To when we do the mapping to figure out, okay, where is this, where can we move the right hand? Okay, we can move the right hand now. So now we have to move the helmet in such a direction on those coordinates to get to the right spot. And the beauty about deep TMS is that it goes deeper. So we're treating more neurons, and it goes broader. So we don't miss the target. And that's a big difference between us and traditional TMS, because traditional TMS is very focal and very shallow treatment. Where we go deeper, we treat more neurons and we don't miss the target. So that's a really key thing with our technology. You asked a little bit about the energy, and I just wanted to make sure that I described that. But in general, it's the same kind of amount of energy as you're getting in an MRI. But that knocking that you hear, right? That knocking is much closer because the coils are closer to your head. And you asked about side effects earlier. The most common side effects that people get are like a headache,
Yeah.
right? Because they feel this knocking on their head, kind of like a woodpecker a little bit. But that's about the
That's it.
extent.
The real attractive difference between an MRI and what you've described, what your machines do, is, at least in my experience, I've only had one,
Yeah.
and never thought in my wildest imagination that I would be troubled by this. It would be uncomfortable, the claustrophobic thing, and I don't want to frighten anyone. If you need an MRI, you got to go get one. But it was not pleasant. There's no other way. It was not pleasant, and it's long. And they can play all the reggae music and show tunes they like into it. It's not going to change the fact that you are entombed in this thing. Crazy noises are going off, and you can't move. Do not move. When every fiber in your body saying, "Let me out of here." So that TMS, deep TMS, allows you all that, openness and space. Is spectacular. Chris, let me ask you this now, with regard to the people who are suffering from depression or
OCD.
And they're at their wits' end. They're psychiatrists who may not have this technology. How do they find out about it? How do they send you? How do the people who need it find out about it?
Well, so if people go to BrainsWay.com, right up in the upper right-hand corner, we have a provider list on there. And we have a growing number of providers. We have roughly about 800 systems out there. Definitely not enough. If we were going to treat just all the depression patients that needed to be treated, we'd probably need close to 50,000 systems. So we're at the very beginning spot here, and we're trying to get out to as many psychiatrists as well. But we're also reaching out to patients to make them aware of it, so that they're demanding the technology from psychiatrists as well.
I think if it came from the consumer or the patient side, it would be much more powerful. Yeah, our underwriter partners, want to use this technology, and I know some personal friends who are in psychiatry. They're very excited by this as well. Let me ask you finally this, Chris, with regard to this treatment being beneficial to people. How often are the sessions necessary, and do they always take place in conjunction with other forms of treatment? Your typical talk therapy, or maintaining. How do you maintain TMS? Is what I'm trying to say. Do you do it with drugs, with therapy? What goes on in addition to TMS?
So everybody is a little bit different, right? We all have different brains, and we're all kind of just a little bit different. So, I think in general, I've been doing medical device for many, many years, as you mentioned, close to 30 years. And most of my life has been focused on cancer. Most of it has been focused in the brain, with neurosurgery in the brain. And whenever you're trying to deal with cancer, you're always going to try to use as many different tools as you can, whether it's surgery, radiation, chemotherapy. There's a whole bunch of other new technologies. And we look here at BrainsWay as, mental illness is a brain disorder. You may have a patient that may have that they get clinical depression. It's episodic. Something happens in their life and they get depression. A lot of people get confused and think, okay, depression, you're in a bad mood. I'm a sports fan. I'm a big New England Patriots fan. We've had a lot of success. But in my early years, we had a lot of lost games, and I would be in a bad mood because of that. But I was never depressed or clinically depressed. So I look at...
That's because you're not a Philadelphia Eagle fan.
Hey, we lost to the Eagles. Come on.
Yeah.
The Philly special.
Yes, we remember that.
Yeah. So, but in general, you can get a patient that can get depression, can get on a medication, can get better, get off the medication, and never have a depression again. Then you can get somebody that can go on a medication, not feel relief from it, look at another medication. I mean, I have so many stories. I've had so many interactions with patients over the last 2.5 years since I've been at the company. It's been amazing to actually see what happens to these patients and how they get better. And sometimes they get angry. They get angry after they get better because they're like, how come I didn't know about this technology? I've had depression for 30 years, 40 years.
Well, what's exciting about this, and is that, as you mentioned, with I'm not disparaging drugs for treatment of psychiatric disorders, but it seems to me, from what I'm talking to people, very often that's less. The drug may be science, the creation of the drug may be science, but the application of it and the efficacy of it is sometimes more art than science. Let's try a little more of this. Maybe that didn't work. Let's try a little more of that. And maybe perhaps that's just the nature of depression. But it seems like technologies like BrainsWays and other TMS technologies are more specific. It's more targeted. It sounds smarter. Is that fair?
I think that's fair, but I think to be fair, like, those drug companies are working hard to come up with something to help people, and they're trying to do it chemically. We're doing it electrically. And the point I was actually going to try to make was sometimes people can just have deep TMS treatment or TMS, and they get better and all is good. And they get off their medication. But sometimes it's done in conjunction. That's the point I was trying to make from a cancer perspective. Because I think, people don't want to be on drugs. And I think that's a nice thing about TMS. But sometimes they have to have the combination of the two together.
Sure. Well, good. I'm glad we made that clear. Chris von Jako, thanks for joining us. Chris, again, CEO of BrainsWay. Give the website address again. People want to find out more about your company.
Yeah, it's quite easy. So it's BrainsWay, right? Like one word. .com. That's easy. And then up in the right-hand corner, you can find the providers, and we have providers throughout the country.
Chris, thanks so much. It's a fascinating topic, and boy, we like to think we're at the beginning of a conversation. It sounds like we are. So we appreciate your demystifying this thing for us, and we'll love to have you back anytime. You can talk a little more authoritatively about depression after Brady left New England. Don't tell me that didn't bum you out. But anyway, thanks so much for joining us on the Behavioral Corner. We appreciate it.
Thank you so much. It was a pleasure to be here. I really appreciate it.
Retreat Behavioral Health has proudly been serving the community for over 10 years. Here at Retreat, we believe in the power of connection and quality care. We offer comprehensive, holistic, and compassionate treatment from industry-leading experts. Call 855-802-6600 or visit us at www.retreatbehavioralhealth.com to begin your journey today.
That's it for now. And make us a habit, hanging out at the Behavioral Corner. And when we're not hanging, follow us on Facebook, Instagram, and Twitter on the Behavioral Corner.